This programme often reflects on the Scottish Government's failure to hit policy targets, but today brought some positive news. The children's mental health waiting time target has been met for the first time in its 10-year history. Official figures show that in the last quarter of 2024, more than 90% of those who were referred to child and adolescent mental health services were seen within 18 weeks.
I'm absolutely delighted. It's a momentous day for us. It's taken a long time, probably too long to reach this point, but I am so delighted to be able to assure the country and children and young people in this country that if they ask for help, they can get it promptly, and that's what today's statistic is all about. There has been an increase in demand, there's also been an increase in complexity, an increase in acuity, and we've seen a health and social care system that's stretched to the limit, and we haven't been without our financial challenges to seek, so it's really remarkable that we've managed to achieve this target.
While there was encouraging news about the increase in the proportion of children starting treatment, the data also shows that more kids are now being referred. We reflected on the mental health challenges facing some of Scotland's under-18s with the GP Becky Howie. Dr Howie, these figures on the face of it are to be welcomed.
Yeah, absolutely. They look quite encouraging, don't they? But I'm not sure that we're feeling that on the ground, if you like, when we're seeing patients.
And what do the stats reveal, though? What are they saying to you? Well,
they're saying that I think that certainly that first encounter that a patient is having with the CAM service is happening faster, but it's whether that ongoing care is still also happening quickly enough. You know, is it just an assessment or is it actually the treatment that's starting? And sometimes the assessment's enough. You know, sometimes these sort of assessments take a long time. We're not talking about a quick 10-minute appointment. It's a good hour and a half, and often the children are signposted elsewhere, and that's appropriate. But for the children that are waiting for, say, psychological therapy, they can still be on a long waiting list after that, and I'm not sure we're gathering that kind of statistic.
And what do you see in your surgery?
Yeah, I see children struggling. I see teenagers struggling. I think there's a lot of factors involved in that. The demand for mental health services has skyrocketed, particularly since the pandemic. And again, there's lots of reasons for that, the pandemic being a huge one. We've also got issues with the cost of living crisis. Children are being exposed constantly. We went from a pandemic into war between Russia and Ukraine, and children are aware of this, and teenagers are aware of this. The world that they live in is a different world to the world we grew up in, and there's a lot of uncertainty in the world. We've not even touched on social media, so there's this huge number of factors that are really having a big impact on mental health, and more people are seeking help and support with their mental health.
What can be done for them, and how important is it to get that attention to them?
Yeah, I think we need to somehow be able to start to improve resilience for our children and our teenagers. I think for a long time, particularly on the back of the pandemic, we told them that school didn't matter, we told them that social interactions didn't matter, that it was okay to stop all of that. And suddenly then we turn around in these developing brains and say, oh no, these are really important things, but we still have massive school lack of attendance at schools. We are missing children from learning how to respond to difficult situations. So life isn't easy as a teenager. We all remember what it was like, but we need to have these sort of ways of encouraging them to manage those uncomfortable feelings without having to turn to, really quite dramatic, difficult things like self-harm, which we're seeing increasing numbers of as well.
And there's also an extra pressure on the service, I suppose, from this rise in neurodiverse conditions. How's that impacting? Yeah,
so there is a huge number of people wanting to have some sort of assessment for neurodiversity for their children, for their teenagers, and it's understandable. Is it that it's on the rise? Is it that we're more aware of it? Is it just become a bit popular on social media? It's really difficult. It's probably a little bit of all of those things, but that's a massive piece of work that we've never had the funding for, and the CAM services are now trying to find the same staff need to do all of these things, and it's a real challenge for the staff that are in these departments. They're not big departments, they're often 7 or 8 people trying to cover hundreds of children, and when you speak to a child who's in distress, that's really hard as a member of staff as well. So we've got to think about their resilience and their well-being as well.
Are these children sometimes do they feel hopeless?
Yeah,
there is nothing for them.
Absolutely. I think they, and parents can feel hopeless. They go to the school, they don't feel they're getting help. They come to see me as a GP and I can't do much about the waiting list. And I think people don't know where to turn. We talk a lot about how society's changed over the last sort of few decades and generations. We used to have families all within an area, and you had granny down the road who had wisdom and support, and we've kind of fractured families across cities, so we don't have that natural community that really support families and children as well. And you know, parents don't have a lot of resilience at the moment either. Parents are struggling, they're working really hard, they have money worries, and then they're trying to look after their children too. So all these things have a big impact on our children and teenagers' mental health.
And briefly, what needs to be done?
Yeah, I think more support for parents, parental classes, more support for children in schools. That early intervention is really important, getting in there with teaching children how to respond to distress in a healthy way rather than in a sort of destructive manner.
Okay.
Yeah.
Well, so a lot to be done, but
absolutely,
we'll see. Dr. Howie, thank you for joining us.
Thank you.